Have you ever wondered what would happen if one day you woke up and realized you had missed the chance to live a healthier, happier life? Imagine this. One morning, you look in the mirror and see a familiar face, but something feels off. You feel more tired, your steps feel heavier, and the joy in the little things seems to have quietly slipped away. You tell yourself it's probably just old age. But is it really? The truth is up to 70% of older adults don't realize their bodies are sending out cries for help until it's too late. And the scariest part, you might be one of them without even knowing it. Today, I want to share a story with you. A story that's not just about health, but about how we can change our lives before time takes that chance away. Are you ready? Welcome to Old Gold Friend. Before we begin, I'm really curious to know where in the world you are watching from. Leave a comment below. Feel free to ask any questions. I'm always ready to answer. And don't forget to subscribe and turn on the notification bell to update the most useful health tips right away. With Old Gold Friend, taking care of your health has never been easier. Imagine this. You're sitting in your favorite chair, sipping a warm cup of tea and reflecting on the years gone by. Life feels steady, predictable, and perhaps even comfortable. But beneath the surface, your body might be whispering warnings that you can't hear, or worse, that you're ignoring. This is the reality for millions of older adults in America, according to the National Council on Aging. NCOA, nearly 95% of adults aged 60 and older have at least one chronic condition, and almost 80% have two or more. These conditions, like heart disease, diabetes, and arthritis, often develop silently with symptoms so subtle that they're easy to dismiss as just getting older. But by the time these issues become noticeable, they've often progressed to a point where treatment is more difficult and the impact on quality of life is severe. And so 2024. Take, for example, the story of John, a retired teacher from Ohio. For months, John felt a slight tightness in his chest whenever he climbed the stairs. He brushed it off, thinking, it's just my age catching up with me. But one day while gardening, John collapsed. He was rushed to the hospital and diagnosed with advanced coronary artery disease. His doctor told him that if he had come in earlier, simple lifestyle changes and medication could have prevented the heart attack. John's story isn't unique. According to the Centers for Disease Control and Prevention, CDC, heart disease remains the leading cause of death among older adults in the U.S., and many cases could be mitigated with early detection and intervention. CDC 2023. Another example is Mary, a 68-year-old grandmother from Florida. Mary began experiencing frequent forgetfulness and occasional confusion. Her family thought it was just senior moments, but when Mary got lost driving to her daughter's house, a route she had taken for years, they knew something was wrong. After a visit to her doctor, Mary was diagnosed with early-stage Alzheimer's disease. Early diagnosis allowed her to start treatment and make lifestyle adjustments that slowed the progression of her symptoms. The American Psychological Association, APA, highlights that while cognitive decline is a natural part of aging, conditions like Alzheimer's and dementia are not inevitable. Regular mental stimulation, physical activity, and a healthy diet can significantly reduce the risk. 2021. So why do so many people like John and Mary miss these early warning signs? The answer lies in a combination of denial, lack of awareness, and the misconception that aging always comes with inevitable decline. Many older adults don't prioritize regular health checkups, and even when they do, they may not communicate subtle changes to their doctors. The consequences of ignoring these signs can be devastating. Chronic conditions, if left untreated, can lead to severe complications, loss of independence, and a diminished quality of life. But it doesn't have to be this way. Experts recommend a proactive approach to aging. This includes regular health screenings, staying physically active, eating a balanced diet, and maintaining strong social connections. Programs like the Chronic Disease Self-Management Program, CDSMP, have been shown to help older adults take control of their health and improve their quality of life. NCOA 2024. The question is, will you listen to your body's whispers before they become screams? Or will you wait until it's too late? The choice is yours, but remember, every small step you take today can lead to a healthier, happier tomorrow. It's a quiet morning and you're sitting at the kitchen table sipping coffee. You feel a slight ache in your back, a little more fatigue than usual, but you brush it off. It's just age, you tell yourself. Days turn into weeks and the signs persist, subtle, almost unnoticeable. But what if these small changes are your body's way of waving a red flag, begging you to pay attention? This is the reality for millions of older adults in America. Many fail to recognize the early signs of health issues, not because they don't care, but because they've been conditioned to believe that these changes are simply part of aging. According to a report by the National Council on Aging, nearly 95% of adults aged 60 and older have at least one chronic condition, yet many delay seeking help until the condition becomes severe. NCOA 2024. Why does this happen? One reason is denial. It's easier to dismiss a persistent cough or a nagging pain than to confront the possibility of illness. Take the story of Joanne Whitney, an 84-year-old retired professor from California. When she visited the emergency room for a urinary tract infection, she tried to explain to the doctor that the prescribed antibiotic wouldn't work for her condition. Despite her professional credentials, she was ignored. "I was dismissed because of my age," she said. It wasn't until she sought help elsewhere that she received the correct treatment. KFF Health News 2021. Another reason is the pervasive ageism in healthcare. Many older adults feel invisible when they visit their doctors. A study by NPR found that ageism in healthcare often leads to both overtreatment and undertreatment. Doctors may dismiss symptoms as normal for your age or avoid recommending certain procedures, assuming the patient is too old to benefit. This bias can have devastating consequences as it prevents older adults from receiving the care they need. NPR 2024. Consider the case of Imogene Stamper, a 91-year-old from New York. After contracting COVID-19, she was sent to an under-resourced nursing home where her needs were neglected. Her son had to fight to get her admitted to a better facility. "They don't respect you once you reach a certain age," she said. This lack of respect and attention is a common experience for many older adults who often feel devalued and unheard. KFF Health News 2021. The third reason is a lack of awareness. Many older adults don't realize that subtle changes in their health, like fatigue, forgetfulness, or mild pain, can be early signs of serious conditions. For example, cognitive decline is often dismissed as senior moments, but it can be an early indicator of Alzheimer's or dementia. Early diagnosis and intervention can make a significant difference. Yet many people wait until the symptoms are severe before seeking help. 2021. The consequences of ignoring these signs are severe. Chronic conditions like diabetes, heart disease, and arthritis can progress silently, leading to complications that could have been prevented with early intervention. But there is hope. By recognizing the signs early, seeking regular checkups, and advocating for themselves in healthcare settings, older adults can take control of their health and improve their quality of life. The question is, will you listen to your body's whispers before they become screams? Or will you wait until it's too late? The choice is yours, but remember, every small step you take today can lead to a healthier, happier tomorrow. It begins with a small, almost imperceptible change. A name forgotten, a slight pain ignored, or a moment of confusion brushed off as nothing more than a senior moment. But what happens when these small signs are left unchecked? For many older adults, the consequences of not recognizing these early warnings can be devastating. Take the story of Margaret, a 72-year-old retired librarian from New York. For months, she experienced mild forgetfulness and occasional difficulty finding the right words. Her family dismissed it as normal aging, and so did she. But when Margaret wandered out of her home one evening and couldn't find her way back, her family realized something was wrong. She was eventually diagnosed with Alzheimer's disease, but by then the disease had progressed significantly. Early intervention could have slowed its progression, giving Margaret more time to enjoy her life with her loved ones. Alzheimer's Association 2023. The consequences of late diagnosis are not limited to cognitive conditions. Physical health issues, when ignored, can spiral into life-threatening situations. According to a report by NPR, nearly 800,000 Americans die or are permanently disabled each year due to diagnostic errors. Older adults are particularly vulnerable because their symptoms often present differently or are dismissed as just part of aging. This can lead to undertreatment or even misdiagnosis, leaving conditions like heart disease, diabetes, or cancer to worsen unchecked. NPR 2024. Consider the case of James, a 68-year-old retired mechanic from Chicago. He had been experiencing mild chest pain for weeks, but attributed it to indigestion. When he finally sought medical attention, he was diagnosed with advanced coronary artery disease and required emergency bypass surgery. His doctor later told him that if he had come in earlier, lifestyle changes and medication could have prevented the need for surgery altogether. James's story is a stark reminder of the importance of listening to your body and seeking help early. Another example is the growing recognition of late limbic predominant age-related TDP-43 encephalopathy, a form of dementia that mimics Alzheimer's but progresses more slowly. Many older adults with LAT are misdiagnosed or go undiagnosed entirely because the condition is not well known. This lack of awareness means that patients miss out on treatments that could improve their quality of life. Harvard Health Publishing 2022. The ripple effects of late diagnosis extend beyond the individual. Families are often left to grapple with the emotional and financial toll of caring for a loved one whose condition could have been managed more effectively if caught earlier. The healthcare system also bears the burden, with billions of dollars spent annually on treating advanced stage diseases that could have been mitigated with early intervention. But it doesn't have to be this way. Early detection and proactive healthcare can make a world of difference. Regular checkups, open communication with healthcare providers, and paying attention to subtle changes in health are critical steps in preventing these tragic outcomes. As Dr. Maria Carney, a geriatrician at Northwell Health, explains, an accurate diagnosis is more likely when patients and families advocate for themselves and when healthcare providers are trained to recognize the unique needs of older adults. NPR 24. The question is, how many more lives must be upended before we start taking these early signs seriously? The cost of waiting is too high for individuals, families, and society as a whole. The time to act is now. Listen to your body, seek help, and don't let the whispers of warning turn into screams of regret. Imagine standing at a crossroads. On one side, a path of vitality, independence, and joy. On the other, a road marked by preventable illnesses, regret, and missed opportunities. For older adults, the choices made today can shape the quality of life for years to come. The good news? It's never too late to take control of your health and well-being. The first step is to listen to your body. Subtle changes like fatigue, mild pain, or forgetfulness are not just signs of aging. They could be early warnings of underlying health issues. According to the National Council on Aging, nearly 92% of older adults have at least one chronic condition, and 77% have two or more. Yet many of these conditions can be managed or even prevented with early intervention. NCOA 2025. Take the story of Helen, a 70-year-old retired teacher from Florida. For years, Helen ignored her high blood pressure, thinking it was just a part of getting older. One day, she suffered a stroke that left her partially paralyzed. Her doctor explained that regular checkups and simple lifestyle changes, like reducing salt intake and exercising, could have prevented the stroke. Helen's story is a powerful reminder of the importance of proactive healthcare. Another critical step is staying physically active. Exercise is not just about maintaining a healthy weight. It's about preserving mobility, reducing the risk of chronic diseases, and boosting mental health. The American Psychological Association highlights that even moderate physical activity can improve mood, reduce anxiety, and enhance cognitive function in older adults. APA 2021. Consider John, an 80-year-old grandfather from California. After being diagnosed with early-stage dementia, John joined a local walking group. The regular exercise not only slowed the progression of his symptoms, but also gave him a sense of community and purpose. His story illustrates the transformative power of staying active. Nutrition is another cornerstone of healthy aging. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can reduce the risk of heart disease, diabetes, and other chronic conditions. The American Geriatric Society emphasizes the importance of hydration and limiting processed foods to maintain overall health. American Geriatric Society, 2025. Social connections also play a vital role. Loneliness and isolation can have a profound impact on mental and physical health. Studies show that older adults with strong social networks are less likely to experience depression and cognitive decline. Programs like AARP's community initiatives help older adults stay connected and engaged. AARP 2025. Finally, don't hesitate to advocate for yourself in healthcare settings. If something doesn't feel right, speak up, ask questions, seek second opinions, and ensure your concerns are heard. As Dr. Maria Carney, a geriatrician, explains, an accurate diagnosis and effective treatment often depend on open communication between patients and healthcare providers. NPR 2024. The choices you make today can pave the way for a healthier, happier tomorrow. Whether it's scheduling that overdue checkup, taking a walk around the block, or reaching out to a friend, every small step matters. Remember, aging is not a destination, it's a journey. And with the right tools and mindset, it can be the most rewarding chapter of your life. If you found this video helpful, please hit the like button. It really helps us bring you more valuable content. Leave a comment below and let us know what you think, what questions you have, or what topics you would like us to cover next. We love hearing from you. Of course, hit that subscribe button and turn on notifications so you never miss our latest health tips. Stay informed, stay healthy, and we'll see you in the next video.